An urgent coronavirus warning tonight.
San Antonio's mayor says the risk level is now severe. In a news conference today, Mayor Ron Nirenberg says we are 100% in a rebound of COVID cases. The mayor announced elective surgeries are being put on hold as hospitalizations surge. He says 88% of COVID patients in Bexar County are unvaccinated.
Health officials say we are seeing lagging vaccination rates, especially among teens and young adults. The lowest vaccination coverage is among 19 to 29-year-olds. Officials are urging people to get the vaccine.
This pandemic and the response to it is not about you. It's about your neighbors, it's about your loved ones, it's about the children in our community, and it's about those healthcare workers who've been working triple time for the last 18 months.
San Antonio will start giving out incentives to motivate people to get vaccinated. The plan is to give out $100 per person in the form of a gift card. The city would use funding from the feds and spend at least $1 million, but there's no word on when the incentives could start. And younger children infected with the coronavirus are now landing in San Antonio hospitals.
Eyewitness News reporter Henry Ramos joins us with the rising risk just before school starts.
And Aaron and Deborah, one of the youngest in intensive care right now is just 4 years old. An 11-month-old also in the hospital for COVID. Tonight, we are getting a clear picture of what it looks like for kids in the hospital.
This variant is grabbing kids.
Dr. Charles Hankins is the chief medical officer with Christa Santa Rosa Health System. He says the Delta variant is infecting kids differently than previous variants of COVID-19.
It really kind of has become a little bit more of a pediatric disease. The number of pediatric beds filled across the country today with COVID patients exceeds even the other two surges at their peaks.
Dr. Hankins says earlier in the pandemic, hospitals were admitting older kids in their teens with COVID and other health conditions.
This time we have younger children. We have a 4-year-old, for example, patient that's on a ventilator, and that we had not seen that with COVID up to this point. We're also seeing kids with less coexisting conditions as their underlying.
The pediatrician says a perfect storm is brewing right now because of three things.
So you've got RSV, unseasonably unusual, hitting early. You've got a COVID spike with a variant that's grabbing kids, and you have school starting at the same time.
The doctor says two best steps before school starts: mask and vaccinations.
If we can decrease it in the community, we're going to decrease the 7-year-old's chance of being exposed to it.
And the risk that a child gets seriously ill is extremely small, but with this Delta variant, this is new territory. Dr. Hankins hopes the vaccine will be available for children 5 to 12 in the fall. In the meantime, he encourages parents of children 12 and up to get the vaccine. In the studio tonight, Henry Ramos, KENS 5 Eyewitness News.